everyone to this important gathering. It's an important discussion on two vital subject matters, children and tobacco reporting. If you at this point is my name, I apologize. I'm unable to use my video. I've tried to play it up, but it's not just coming on. So kindly bear with me. So today I would moderate this session alongside with Frida. Frida is with the Vital Voices for Africa. So she will be doing this with me. Welcome you all once again. Right now we are behind schedule and we are meant to do a brief round of introduction just to know people in the room, where you are joining us from, your affiliation, your organization, and just what you look forward to taking away from this important discussion, this important gathering. So if you don't mind, I would need your indulgence to use the chat room to drop your introduction. Kindly drop your name, your organization, and just anything you feel we should know about you. Please drop that in the comment section. So without wasting time, we'll be going straight into the opening remark, and we have two executive directors who will be doing the opening remark. First is Philip Jappo. Philip Jappo is the executive director of Renevlyn Initiative, while Caleb Ayong is also with us today. He is the executive director of the Vital Voices for Africa. So they have 5 minutes each for the remark, and I would hand over to Philip first, then Caleb thereafter. Mr. Philip.
Okay, can you hear me?
Yes.
Can you all hear me?
Yes.
Okay, great. So thank you very much, Ife. Now Ife is on transit, so we have to bear with her. My name is Philip Jaco, Executive Director of Renevlyn Development Initiative. We are co-organizing this event along with Vital Voices for Africa and Being Africa, our partners. I'd like to start by saying that we are commemorating the World No Tobacco Day, which is celebrated at first today. And the World No Tobacco Day is marked, by we use the opportunity to pressure governments and genuine stakeholders in public health across the world to take actions to prevent deaths, disease, and disabilities associated with tobacco use. It is also an important occasion to expose the antics of the tobacco industry to undermine public health through their leather products. Tobacco use, as most of you must have heard and know, is the single most preventable cause of death globally. Tobacco kills up to half of its users, and by the year 2030, the WHO projects that tobacco will kill more than 8 million people every year, with most of these deaths unfortunately happening in low and middle income countries like ours. So tobacco is a major risk factor for non-communicable diseases such as cancer, cardiovascular diseases, diabetes, and respiratory illnesses. Now, the theme of the World No Tobacco Day 2024, protecting children from tobacco industry interference, aims to pressure national governments to implement comprehensive policies to prevent the tobacco industry from grabbing the lungs of our children as replacement smokers. As you and I know, the older generation of smokers are dying. The industry feels it must replace them, and our children are the target. Research has shown that about 1/3 of youth experimentation with tobacco occurs as a result of tobacco industry marketing and tobacco advertising, promotion, and sponsorships. Worldwide, 78% of young people aged 13 to 15 years report regular exposure to some form of tobacco advertising, promotion, and sponsorships. And more recent research has shown that children as young as 10 are also getting inducted into smoking due to their exposure to the internet and other factors that you are going to hear about from our speakers today. So in ensuring that our governments take the World No Tobacco Day message seriously, the media must play a strategic role in exposing what the industry does, and most importantly, to be able to write or broadcast incisive reports to elicit policy-level intervention. It is the media that must put our governments on their toes to ensure that they do not check their primary responsibility of protecting our children. This understanding informed our organizing this capacity building discussion to further hone the reporting skills of our participants. Like I said, we're happy that this event has brought together different regions of Africa. We have people from Zambia, Kenya, Nigeria, Ghana, Togo, Cameroon, and others. So we're happy that this event has brought together different regions and countries of Africa together to speak with one voice on one issue of primary concern, which is how to protect our children from tobacco industry interference. So once again, I want to thank you for honoring our invitation. So I want to hand it over to my friend and brother, Caleb, who is the Executive Director of Vital Forces for Africa.
Thank you very much, Philip. Dear media colleagues, thank you very much for joining us this morning. It is an honor to gather here today virtually as we commemorate World No Tobacco Day 2024. This annual observance serves as a powerful reminder that our collective responsibility to protect the health and well-being of our communities, that lies exactly on us. It is our responsibility, especially the youth. The theme for World No Tobacco Day resonates deeply, protecting children from tobacco industry interference. As we step into this critical conversation today, let us recognize that our actions, what we do today, will shape the future of our generations to come. And we at Vital Voices for Africa are committed to ending the manipulative tactics of the tobacco industry, tactics and strategies of the tobacco industry, targeting young people, whom we know very well are seen by the tobacco industry as replacements for the 8 million people who die every year from tobacco-related causes. The tobacco industry's tactics are cunning. They are targeting young people, enticing them with flavored products and perpetuating addiction. But we stand united against this predatory marketing. Our mission is clear: shield our children from the clutches of tobacco, empower them with knowledge, and advocate for policies that prioritize their health. As journalists, you hold immense power, the power of the pen, the lens, and the microphone. Your words can ignite change. Your words can expose tobacco industry lies. Your words can inspire action. Today, let us pledge to amplify the voices of our youth, to unmask the tobacco industry's deception, and to create a world where every child breathes freely. Together, we can turn the tide. Let us be the storytellers who illuminate the path towards a tobacco-free future. Thank you once again for joining us in this crucial journey, and welcome to our World No Tobacco Day 2024 webinar. Thank you very much.
Thank you so much, Mr. Philip and Mr. Ion. Thank you so much for such wonderful remarks. I believe the remarks laid a very solid foundation for why we are here and why it's important to pay more attention to tobacco reporting, especially as it relates to children addicts. So right now, we would be hearing from a tobacco control advocate from Nigeria. She would be talking to us about children addicts and experiences from Nigeria. So I would invite Oluchi Joy Roberts to take the floor now and share with us some of the experiences.
Okay, hello everyone. This is me, but from personal reasons, I'm going to put my camera off. You know, these people who live rent-free in your houses, they are walking up and down, so it's going to cause distraction. But I'll bring it back on just before we close. So, World No Tobacco Day every year is something that I hold dear to my heart. My reasons are quite obvious. I have kids. I have a lot of young people around me, and it gives me great concern that the tobacco industry is just all out to get kids, because once they get them when they are young, they are gone for, and that's like them expanding their market. So when I was informed I was going to be talking about, how they addict children and, share experiences from Nigeria, I was actually very, very elated. So please, if you can help me share the PowerPoint presentation so we can just start off. I want to make sure I stick to the time and not exceed 10 minutes. All right, thank you. Okay, tobacco industry addicts children, talking about experiences from Nigeria. Second slide, please. So most of the times when we talk about tobacco industry and their activities, the information we have and we share, we do not get it out of the blue. The WHO had a news release May, we are still in May, where they recognized that Nigeria is the 7th most populated country. So even the tobacco industry understands this. So that means the huge, large population is an enormous income potential for them. And that will also translate to the fact that they'll be expanding their GDP. Nigeria is a country where you have not just youths, but youths that are active. When we talk about youths, even looking at children from 7, from 11, because you will hear cases of child addiction that will amaze you. So from 7, from 11 up until 24, 25, they are all out to get these children in Nigeria, and they try different means. They have variety of tactics, and we are going to be looking at the first one, which is product marketing. If you could go on to the second slide, please. So they use appealing packaging to target young people because, naturally, young people like things that are colorful, that are cool, and they ensure that they have things like vaping pen that are disposable. You have the ones that are pre-filled. You have the ones that are refillable. And these products, they look like everyday commonplace. So children sometimes look at it and feel like, maybe it's not so much of a big deal, and they want to try it out. From trying it out, addiction sets in. And another bad thing about the product marketing tactics they adopt is that these disposable vape pens are cheaper than cigarettes. So the young person can actually start the addiction without breaking a bank. They are easy to use, they are waterproof, and they are quite strict. If you go on to the next slide, I have a few pictures of what some of these products looks like, because even parents here, so you can see what a disposable vape looks like here. These are even in plastic container, because the way they look, they are fanciful. Even me as an adult, you look at this, you would want to give it a try. And it is from giving it a try that addiction starts. Look at what a shisha kit looks like. I'm talking about Nigerian experience. I don't know what is obtainable in other countries. If you go on to the next slide, where you have vaping pens, look at how they are colorful, fanciful. The tendency is that our young people would want to lay hands on it, try it, and from trying, addiction starts. Another tactics they use is advertising. So they covertly engage in, product advertisement through product placement in movies. Yeah, even though we've gone through the issues of regulations in 2015 and the regulations in 2019 and the act in 2015 banning this. Part of the act borders on self-restriction via internet to persons under 18, but the tobacco industry, believe you me, goes ahead to find subtle ways to bring these products. There's this movie we watched in Nigeria some time ago, King of Boys. The level of puffing that went on in that movie is alarming. And it was done by a so-called role model to young people. They see them doing this, talk about the issue of influence, they will want to copy because they feel it's a cool thing to do, you know. So they still covertly engage in trying to expose young people to smoking through subtle dropping of these images and branding in movies, music videos. However, if you go on to the next slide, yeah, so there was a cross-sectional study of adolescents, adolescents in Lagos in a school in 2020. And because a survey was conducted that period, so most of the children there reported that their channel of exposure was through product placement. And we can see what the percentage is. A whooping 62% was through films, TV, and videos. 15.2% was through promotional activities, and 12.6% were exposed through sponsorship. So they do not stop, they do not give up. They keep trying to look for subtle ways to ensure that these products are kept in the face of our younger ones. The next tactic is flavored products. So this one is actually a killer because we know that most young people have sweet tooth. They love, eating candies, fruity and minty things. So the tobacco industry does what? They take these flavors and mask the unpleasant taste of tobacco with these products. So it makes it appealing to the kids who use this thing. They use menthol. They just keep coming up with different strategies to persuade kids to use tobacco by layering it with different flavors. They have variety of flavors that they use. The next slide, please. Next slide. So you can see this one is watermelon ice flavor. Even the name sounds cool, sounds nice, sounds interesting. You want to taste. The other one is called blue raspberry ice. Look at it. It looks enticing to the eyes. So the sound also to the ears. The tendency is that you want your taste buds to have a go at it. Another tactics they use is making sure that these products are accessible through stores, through online platforms. Yeah, put something there. It might interest you to know that you can order a whole vaping kit and a complete shisha smoking kit from Jumia, from Congo, from Gigi. You can even get same day and doorstep delivery. In fact, on Conga, because I had to try it myself, so it doesn't look like I'm talking, out of context. You can get next day delivery for a complete shisha kit for as low as 7,000 naira. And this has been available on Conga for over 5 years. Meanwhile, restriction sale over the internet is part of the things that they act and regulations address, especially to people under 18. What does this mean? This means that, you go to private universities where you have young people that are like maybe 16 years, 17 years. That means they can actually, in the comfort of their dormitories and off campuses, order these products online and you'll be delivered to their doorsteps and they will go ahead and use it unsupervised. Well, time will actually fail me to talk about a whole lot of other actors, especially peer influence. And this is where we as parents come in. So yes, so this is actually a screen grab I took from Jumia, letting you know that these things are still available online. So I just need to click add to cart. In fact, I tried buying this online, but I had to stop because of course I don't smoke shisha. So I just had to add to cart, and you can see by the side, pickup station, you pay 250 to pick it up. If you want doorstep delivery, and they even have a return policy, like you can change this one and get another hookah pot. So time will fail me to talk about other issues like peer influence, which is where parents actually come in. You cannot leave raising your children to the school because you pay huge school fees and to religious organizations. When your children come back, you need to find out what is going on with them, what they have in their bag, and all that stuff. I want to say a very big thank you to the people for having me. And as the theme for World No Tobacco Day 2024 implies, we need to keep fighting to protect our children from tobacco industry interference. They do not give up. They do not stop. We should not stop. Thank you.
Thank you so much, Ma, for that wonderful presentation, especially the statistical part. I really appreciate the numbers, the percentage. Personally, I feel when we put numbers to things, it enables us know the gravity, the weight, the importance of such subject matter more. Thank you so much. Would be opening the floor for questions. I don't know if anyone have any question for Madam Oluchi Joy. Any questions at all? You can either unmute or use the chat room.
I think it would be better if we have questions at the end when we have a Q&A section. We can go with the presentations now.
Okay.
And then we'll have questions at the end. Thank you.
Okay. Okay, thank you. Okay, then we can move to the next presentation then, which is by Paxina Fury. I hope I got that right. I'm sorry if I have murdered your name. So it's also about children addicts, and this speaker will be sharing experiences from Zambia. This is a time for us to know. Now we've heard perspectives, stories, and experiences from Nigeria. It's now time to move to the Zambia, and Paxina Fury will be doing that for us. He is the communication officer, he or she, I'm not sure of the gender, I'm so sorry. Communication officer for the Center for Primary Care Research, CPCR. You have the floor. Okay, she. I'm so sorry, I wasn't sure of the gender.
It's
okay.
It's okay. Thank you so much, and thank you so much for the opportunity to be part of this webinar. I'm really delighted. I'll have to switch off my video so that I can do the presentation. Thank you so much to the host that have invited me to do this presentation. Thank you. So my name, as Elias said, is Paxina Piri. I'm the communications officer for the Center for Primary Care Research here in Zambia. And I'm just taking us through 10 minutes to take us through an effective reporting on children and tobacco addiction. The next slide. As an introduction, I'm saying reporting on children and tobacco addiction is a critical issue that requires careful consideration and a responsible approach. And here's an introduction to reporting on this topic. Understanding the issue for me is really important. I remember as a journalist, I started reporting even before I knew Zambia ratified on tobacco, because from a younger age, I used to get an allergy when I'm nearby a person who's smoking, so I would develop a flu. So I developed an interest to start reporting on tobacco. So understanding the issue at hand as a journalist is very important. And tobacco addiction among children is a significant public health. It often begins in childhood or adolescent. As in Zambia, as we can see, you find that many parents are smoking. They'll send a child to go and buy cigarettes. Or if they have it in the house, they'll send a child to go and light it up. And I remember my experience as well, where they'll send you to go and light up a cigarette. So as you are bringing it, it has to be lit. So you have to puff it to make sure that it's well lit. So, as a result, children get hooked on tobacco, on smoking quite at a younger age. And as journalists, we need to understand that and see how we can protect our children. The next slide, please. So there are factors that are contributing to tobacco addiction in children. And in Zambia, the case of Zambia, accessibility is really quite an issue, as we see, children accessing these cigarettes everywhere they tend to, because starting from their homes, as they go to school, there are nearby kiosks, that sell these products. And it is very easy for a child, because the price of a cigarette is cheaper, just as good as buying a lollipop, which is a sweet, And so we see all these kiosks, shops near homes, near schools. That children go to school, they'll find, cigarettes on display everywhere. They tend to, and at a very cheaper price. So accessibility in Zambia is really quite a concern, because everywhere you tend to, there are these shops that sell cigarettes. Peer pressure also, we have seen that a lot of children, in groups, one could be, coming from a home where parents are smoking or the guardians are smoking. And, they may have started, we did, I think, a survey in 2021 where we went to schools and found out that children, started smoking quite early because maybe someone in their house was smoking, maybe a guardian, a brother, and they eventually start smoking. And because sometimes as they go to school, as they play around, there's peer pressure from these children that start smoking early. You find other children also adapting to the habit. The next slide. Marketing also, we see these products, cigarettes, being sold everywhere in Zambia and being packaged in a way that would attract children. You go to the malls, you go to the shops, these are cigarettes that are packaged, like sweets, that children would go to the shop to buy a sweet and they find next to it, there's a pack of cigarettes. And it appeals to the children. So we've seen that marketing of these tobacco products here in Zambia, is quite an issue also, as we even push to the enactment of the tobacco control bill. This is a big issue because these products are packaged, to appeal to children to want to buy or taste, as they go in these malls, maybe with the parents or they're on their own, with their brothers, elder brothers or sisters, and they want a sweet, and they find that next to it, there's these cigarettes that are packaged in a nice way. In ShopRite, for example, if you go there where they sell chocolates, that's where they've displayed the packets of cigarettes in a very appealing way to the children. So this is also a concern here in Zambia. And then also we've seen the media, positively covering the tobacco products in a glamorous way. This we have seen in movies, in films, in stores, that sell them. And it's quite a concern because what children see, on media, as we know that media is a very powerful tool. Whatever children see, they tend to copy. They want to try it. They want to taste it. And so we have seen that media, has also contributed, to children starting smoking early through their coverage, through their reporting. We have seen a slight different trend, though, recently, where the media, is trying to expose the dangers of smoking or the dangers of tobacco, and which is a very positive change, so that the children know that these are not products to play with, because in the end, they get addicted and it kills them. And then what are the key elements of effective reporting? As a journalist, I think accuracy is one of the major elements that we can have, so that we raise awareness, we inform policymakers, and also mobilize our community to action to combat the tobacco epidemic among the youth. The other thing is also to ensure that all information is factual and up to date. We use credible sources such as the WHO, World Health Organization. We as a Center for Primary Care Research, also a research institution that have got facts, have got, evidence of the harms of tobacco and many other sources. Also, sensitivity is very critical. As a journalist, be mindful of the impact of your reporting on children and their families, taking into consideration children's rights. Also, avoid sensationalism and respect the privacy of a child. Awareness also is another thing, where you highlight factors contributing to tobacco addiction in children, including targeted advertising and social media determinants of health. Another slide. We have challenges in reporting on these issues as a media, and one of it, a major one, is the tobacco industry influence. Where they influence the media through advertising. So we must be aware as a media of the tactics of the tobacco industry. One of it is to influence media by giving, paying a lot of money to have their adverts, their messages carried out on our platforms. So we have to be careful of that. We also have the navigating sensitivities. Reporting on children, especially on issues like addiction, requires a delicate approach to protect their privacy and well-being. Complexity of influence. The media must address the complexity or complex factors that contribute to tobacco addiction in children, such as advertising, peer pressure, and family habits. Regulatory constraints. There are often strict regulations regarding what can be reported about minors, which can limit the scope of reporting. Verification of information also is important. As journalists, we have to ensure that the accuracy of information regarding tobacco use among children can sometimes be difficult due to the clandestine nature of such activities. Impact on public perception. Media reports need to balance raising awareness without inadvertently glamorizing tobacco use or stigmatizing affected children. Next slide. Effective reporting can play a critical, vital role in raising awareness and shaping public policy and ultimately protecting children from the dangers of tobacco addiction. It's about providing information that can lead to positive change and support the health and well-being of young generations. And in conclusion, I would say that Zambia is yet to enact a tobacco control bill, which has reached an advanced stage. And this is going to help protect the children from the tobacco industry interference, as they are the target of the tobacco industry. And so this bill would really help. Zambia, like many other countries, also have easy access to tobacco products, including the e-cigarettes that are freely displayed in shopping malls. Zambia freely sells cigarettes near schools and kiosks and near homes, and children can easily access them. Affordability is also another factor contributing to easy access of these products. I know as a major concern also in Zambia. Thank you so much. I think that should be my last slide. Hope I'm within my time. Thank you so much.
Thank you. Thank you so much for that wonderful presentation. Really appreciate the efforts you put into putting this together. And one thing I'm seeing here is the scaffolding that is happening in the presentations of both speakers that have done their presentations. And I see them hammering on the role of the media and even how the media is also an avenue for the promotion of such products, of tobacco products, maybe through films, TV shows, even advertisements. Some news media accept advertisements from tobacco organizations without censoring, without filtering how this would impact children. And children are vulnerable groups in the society and must be protected at all costs. Thank you so much, Faxina. Thank you for the wonderful presentation. Because of time, we would move straight to the next presentation, and that's by Mr. Caleb Ayong, the Executive Director of the Vital Voices for Africa. So,
It's rather
Mr.
Achieng.
Ayong would be
It's
leading
rather
us on a
Achieng.
presentation
Achieng
on.
would then
Can you hear me?
It will be Achieng, not me. I'm coming after. I'll be coming after. It's Achieng for now.
Oh, okay.
I'm swiping places with Achieng.
Okay, so Cheng is swapping places with Caleb.
Okay.
So he's coming first now.
Okay.
Yes, for some reasons.
Okay.
Yes. Yeah.
Oh, all right. Thank you for letting
I'm
me
sorry.
know that.
I'm sorry I didn't get the updated version to you. So this is
No
the updated version.
problem.
Okay.
No problem. Then I will be welcoming Mr. Samson Achieng, the founder of Being Africa. So he will be talking to us about FCTC and children rights. You know, all the international laws, the WHO sponsored rules and regulations regarding children rights and how all this pertain to tobacco control. So Mr. Samson Acheng, you have the floor, sir. Is Mr. Acheng in the room? Hello?
It looks like we lost Acheng. We could get on to the next speaker, and then if he joins us later, we should be able to get back to him.
So if Acheng is not in, that means Caleb, you will be coming in, right?
We can go to Mohammed.
Okay.
All right, can we put up the presentation?
Sure. So as we pull up the presentation, we can also at least know who Mohammed is.
So good afternoon, everyone. My name is Mohammed Mekwadi. I'm with Development and the country lead on the data program. And data stands for Data on Youth and Tobacco in Africa. Next slide, please.
Give it a moment, it's coming.
Oh, no problem. So I'll continue talking before it comes up. So what data is? So despite a lot of public awareness efforts and the adoption of the Framework Convention on Tobacco Control by more than 179 countries, we all see that tobacco usage is still on the rise in low and middle income countries, including within Southern, Western, and Eastern Africa. Sorry, next slide. And unless serious tobacco control initiatives are passed and successfully implemented, tobacco use could actually double on the African continent within a decade. And to pass these policies and implement initiatives, it actually requires data. But unfortunately, there is no single resource to access comprehensive data that governments need to make policy decisions in Africa. There's a TCDI, which is the predecessor to DATA, which stands for the Tobacco Control Data Initiative, initially began working to fill this gap in a number of countries, creating websites for the DRC, Ethiopia, Kenya, Nigeria, South Africa, and Zambia that integrate both primary and secondary research to present comprehensive data on tobacco use. I'll share the link to TCDI shortly. So while we were implementing TCDI, we became increasingly aware of the limited data on adolescent tobacco use. And these three specific types of data that we know to be missing are data about out-of-school adolescents and females, data on certain age groups, and data on novel or newer types of tobacco products, such as my colleagues presented earlier, as vapes and shisha. And this is important because young people shape these trends, markets, and systems, and accurate data on tobacco use among African youth is essential in regional tobacco control efforts. And this data is especially important because African countries have some of the youngest populations in the world. In Nigeria, for example, 52% of the population is younger than 18. And what also further complicates this dynamic is how prevalent use of tobacco product is among these young people. One cross-sectional study that was conducted in 8 African countries found that in some places, more than 36% of adolescents between 13 and 15 years old have reported having smoked cigarettes. So therefore, any actions taken today will impact not only young people's future selves, but also the health and well-being of their country and region going forward. And unfortunately, what we find is that available data on tobacco use among youth is either often outdated, like in Nigeria and Kenya. A lot of the data is well over 12 years old, or in cases like the DRC, it doesn't exist. So therefore, policymakers' ability to make data-informed decisions to advance tobacco control policies is often significantly limited. And the data program is focusing on, so most of the available evidence captures data between, even though it's old, between 13 to 15 years old, even though, as my colleagues mentioned earlier, that sub-Saharan African shows that, like, evidence from sub-Saharan Africa have shown that the age of smoking initiation among young people ranges from even as young as 7 years old to about 16 years old. So, as I mentioned, it's also important to gather most up-to-date information so that you can make relevant and inclusive policy decisions to address these youth issues. And in Nigeria, what we're doing at the moment is we're rounding up a cross-sectional nationwide survey among adolescents aged 10 to 17 in urban and rural Nigeria. And this will be a household-based study where these individuals between 10 to 17 will be interviewed. And this differs from previous surveys in that other surveys like GOITS, for example, are school-based surveys. But what we're also seeing in Africa is that anywhere between the ages of 10 to 17, you have as little as 20%, well, not little, but at least 20% of youth are out of school and up to 48% in certain age groups. So that data that's coming from GYTS only actually captures a subsection of the youth. It doesn't necessarily incorporate the reality of those that aren't in school. So, which is why we opted to do an out-of-school study instead of a home-based study, instead of an in-school-based study. Next slide, please. So our approach for this, of course, we're building on existing research designs implemented across the continent. And the reason we're doing this is this approach allows us to leverage on proven methodologies and tailor them specifically to our target demographic, which includes a significant focus of out-of-school youth, as I just previously mentioned. And doing so ensures our data is inclusive and representative of the broader youth population. And with this, we're creating a one-stop shop for tobacco data to streamline access to tobacco-related data. And this will be achieved by incorporating what we're doing on the data program with youth and incorporating that into the TCDI initiative online country profiles, which I'll be sharing. And by integrating our findings into these established profiles, we provide stakeholders like yourselves and government and academia with a comprehensive resource for understanding tobacco use among adolescents. And we've also built on the strong relationships and expertise developed during TCDI through relationships with RDI and some of our other partners. And we'll continue to engage with stakeholders from various sectors, including government, civil society, academia, and youth organizations. And these collaborations are really essential for the success of our research and for ensuring that our findings will be effectively utilized. And another key component of this data program has been strengthening local capacity. And to this end, we have engaged African firms to coordinate the research across all 3 participating countries for data. And this approach ensures cultural relevance, one, and contextual understanding, but also fosters local expertise and sustainability. And by empowering these local researchers and institutions, we hope that we're building a foundation for continued tobacco control efforts and research in the future. So by building one, existing research, building on existing research, two, creating a centralized data resource, three, leveraging stakeholder relationships, and four, strengthening local capacity, I think we're well positioned to make a significant impact in the fight against tobacco use. And next slide, please. Yeah. So our timeline, it's a 3-year program. We're currently in the implementation stage, where we've rounded up the research in Kenya and DRC. Nigeria, we're about 2 weeks from rounding up. And just to want to be cautious of time and just to connect this back to the theme of this year's World No Tobacco Day, youth step in and speak out, protecting children from tobacco industry interference. This theme underscores the urgent need to protect our young people from the predatory marketing tactics of the tobacco industry. And globally, about 37 million youth aged 13 to 15 are currently using tobacco, with e-cigarettes usage being among the fastest to be on the rise among adolescents. And the health risks are significant. They contribute to cardiovascular and respiratory diseases, various cancers, and other severe conditions. And every year, 8 million people die from tobacco use, with most of these deaths occurring in low and middle income countries like our own, heavily targeted by the tobacco industry. Then you also have the issue of secondhand smoke, which also poses serious dangers, causing another 1.2 million deaths annually and affecting nearly half of all children worldwide. And economically, the cost of smoking is immense. It's about, I think, 1.4 trillion US dollars per year, with developing countries bearing a significant portion of this burden. So the data program aligns with World No Tobacco Day by focusing on, one, data collection, filling critical evidence gaps by gathering detailed data on tobacco use among adolescents aged 10 to 17 in Nigeria, Kenya, and DRC. Two, evidence-informed decision-making. So by providing robust data to enable informed decisions by government stakeholders and policymakers on tobacco control measures. Then you have three, policy support. We're actually trying to strengthen the evidence base for developing and implementing effective tobacco control policies to reduce youth tobacco use. And lastly, stakeholder engagement. We're also ensuring that the collected data meets the need of media, civil society, academia, and advocacy organizations to support comprehensive tobacco control efforts. So I think that's it. Thank you very much.
Mohammed, I want to thank you, and I know every one of us is also thanking you for that intervention, which gives us a clue and a peep into what the data is intended to achieve. And of course, it fits very, very well into the theme of this year's World No Tobacco Day, which is about preventing children from tobacco industry interference. So I want to thank you. Question session will be at the end. Ife has left us. She's on transit, in transit, sorry, in somewhere in the US. So I think Frieza is going to take over, but before she does that, I'm going to introduce Acheng, who is the founder of Bean Africa. He's also one of our strong brothers who has been in the sector for long. So he also speaks with a lot of authority. So Acheng, I want to bring you in. And I think Are you going to be presenting from your own system, or you want us to project from here?
Yeah, let me present from my side. I'll
Okay,
share my
great.
screen. Thank you.
Okay, great. Thank you. Welcome.
Okay, thank you very much, Philip. And my apologies once again for having dropped off. I was in another meeting, so I had to step out a bit. But all the same, thank you very much, everyone, for joining us. And thank you, Philip and Caleb, for making this possible. As Philip mentioned, my name is Achieng Otieno. I run an organization called Online Voices, which is basically a digital communication agency for nonprofit organizations. And through Online Voices, we founded Being Africa, which is, as we proceed on, we'll get to know what our reasons for being is all about. My short presentation is going to be about on Framework Convention on Tobacco Control and children's rights. So let me just proceed on. Maybe just for starters, for anyone probably who's struggling to know what Being Africa is all about. Being Africa is an initiative of Online Voices, basically with the purpose of informing, inspiring, and involving everyone in the fight against non-communicable diseases. The previous presenter who came before me spoke about the disease burden of tobacco use among young people. And clearly in Africa, we know that Africa is one of the continents that has been disproportionately disadvantaged, actually, affected by the issues concerning non-communicable diseases. So Being Africa is here to help with the efforts of trying to address this burden by raising more awareness, by inspiring, sharing more of lived experiences, and involving everyone to deal with the risk factors. From this year's World Not Tobacco Day theme that looks to protect children from tobacco industry interference, it's very important and imperative for us to look at basically what the tobacco industry does vis-a-vis the rights of our young people. When the Convention on Rights of the Child clearly states or explains basically who children are, what their rights are, the responsibilities of governments, and the convention clearly states that all the rights of the children needs to be are important and need to be protected at all costs. And in tobacco control, one of the key things or key pillars that we peg all our advocacy efforts on and policy pushes relies strongly on the World Health Organization Framework Convention on Tobacco Control, which we loosely term as WHO FCTC. Basically, what WHO FCTC is, it's a blueprint for governments to adopt effective tobacco control measures to protect the public from the devastating health, environmental, socioeconomic consequences arising from tobacco consumption and exposure to tobacco smoke. So based on this blueprint, the Framework Convention has very clear provisions on what government needs to put in place in order to safeguard the health of their citizens, and also to rather prevent the tobacco industry from their known interferences and influences. Of importance, the Framework Convention on Tobacco Control has 11 parts, and it's a very comprehensive document with the 30 plus articles. But for this presentation, I'll just narrow down to mentioning a few that are very important in aligning to the theme that we have for World No Tobacco Day. and also looking at the children's rights. WHO, like I mentioned, this comprehensive document has over 30 articles. And when you look at this Article 13, which looks at the ban of tobacco advertising, promotion, and sponsorship. Clearly on my presentation, you'll see I've grayed out a bit. I'm talking loosely of tobacco and nicotine. This, we are trying to be alive to the fact that the tobacco industry keeps re-engineering and reinventing itself with innovative products that are meant to lure young people into the use of their products. So the provision talks about tobacco, ban of tobacco advertising, promotion, and sponsorship. It all under Article 8, it talks about smoke-free environment, and Article 6 talks about taxation on tobacco and nicotine products. I'm also loosely adding nicotine because we are trying to be alive to the fact that the tobacco industry is clearly introducing new products that are meant either to circumvent or maybe to even lure young people into tobacco use. Then there is the ban on sale of tobacco and nicotine products to and by minors. That is Article 16. The main purpose of the Convention for the Rights of the Child and the WHO FCTC is to safeguard the rights of children by protecting or by preventing them from harm and promoting welfare of all children. It's also geared towards protecting the rights of children. We've seen a number of cases where young children are being used in tobacco farms. There's a lot of child labor. There's a lot of children dropping out of school, and all these are basically rights that our young children are supposed to be enjoying. Of importance, we are looking at Article 5.3. Article 5.3 talks very carefully about tobacco industry interference. This is one article that has been comprehensively articulated within the convention, and this is a call to action to actually government and parties to the convention to protect tobacco control policies from the harmful influence of the tobacco industry, because it's clearly noted that the tobacco industry's interest is majorly profit, not public health. When you look at Article 8, it clearly gives provisions for smoke-free environment in indoor workplaces and outdoor public places. These are policies that are required when you think of enforcing. You realize that children are usually highly disadvantaged when it comes to exposure to involuntary tobacco smoke. And that's why this provision of the convention becomes a very key pillar to protecting children's rights. You're also looking at Article 11, which it sort of describes the important forms of health communication and packaging. We are looking at the packaging of tobacco products. We are looking at pictorial health warnings, which are supposed to deter people from, or rather, inform people of the deadly effects of these products, and also which is also known to and help people to quit, to reduce the tobacco consumption. And these are articles that are pegged on the WHO FCTC. But now, even as we are looking at this global convention that is meant to help countries or governments to protect and safeguard the rights of the children and the health of the children, there are clear challenges and gaps that are also coming out. As clearly mentioned, we've been engaging in tobacco control advocacy for a number of years. And these are some of the challenges that keep repeating themselves, like the tobacco industry interference. Due to their financial muscles and their interest in profit, the interference is usually very visible, where they try to interfere with how policies are being formulated, how policies are being enforced, and how policies are being sort of being put in place. And then there is the emerging tobacco products. In Africa, we are becoming highly disadvantaged with the introduction of these new products, because clearly we have no clear research about these products, and we have very weak policies in terms of addressing the challenges that are coming up in this project, emerging products. Then there's the weak enforcement structures. Clearly, Africa is highly disadvantaged by this. And when you look at our policy makers and people, duty bearers, when it comes to enforcement, they are more or less compromisable when it comes to performing their duties. Then there's lack of political goodwill. Africa, most countries in Africa share more or less the same political pattern, where after a certain number of years in Kenya, we are talking after 5 years, there is a new crop of leadership that comes in that you have to again reorient on issues tobacco control. And you find that most political leaders who take some of these offices are already compromised. They probably in their campaign money, they were funded by the tobacco industry. So they end up pussyfooting or dancing around issues to do with tobacco control. But having talked of the threats and the gaps that are there are very clear opportunities that we are seeing as a group. When lobby groups and media work together, we've seen a lot of improvement and a lot of milestones being covered. Like for instance, in Nigeria, just recently, we had a major win where the movie industry is now safeguarded from tobacco for advertising of tobacco and even just promoting tobacco use. We are also seeing an increased room for reporting, particularly on children's rights violation by multinationals, particularly those who are dealing with tobacco and nicotine products. There's also an opportunity to expose tobacco industry tactics, particularly those that are targeting young people or young children. You see most of the new products that the tobacco industry is coming up with are flavored. The designs are a bit sleek, and clearly the colors that are very attractive, particularly to young people, and even the flavors that are there are flavors that are clearly put in place just to attract young people. Having looked at the challenges and the opportunities that are there, so what should we do? Governments, this is a call to tobacco control advocates who are at the forefront in ensuring government steadfast in terms of protecting public from the harms that are caused by tobacco. And most of all, it's a call to government to protect its citizens from tobacco and nicotine use, particularly among young people who are being initiated into tobacco use. A lot of research has shown that most young people who are addicted to tobacco started using the tobacco products at their very young ages. And due to the addictive nature of tobacco products, they are now struggling to quit. So government also need to put in place measures to protect the public from secondhand smoke. They also access to information in most countries, particularly in Kenya, it's a constitutional right. When you look at the Convention on Children's Rights, it's also part of the right of the child to have the right information and the right education, particularly on the harms caused by tobacco. African governments also need to be steadfast in protecting their citizens, or particularly the public health policies from tobacco industry interference. This means governments need to follow clear guidelines that are provided under WHO FCTC, particularly Article 5.3. Then there is also the need for governments to support those people who want to quit tobacco use, people who are addicted to nicotine, addicted to tobacco products, to have services that will enable them to quit these vices. And maybe for that, my apologies for rushing through, but due to time constraints, I think I'll leave it at that. Thank you very much. In case you need to know more about Being Africa, our website is there. In case you need to know more about Online Voices, our website is there. And you can follow us on our social media platforms. That is Being Africa on all platforms. and the online voices on all platforms. Thank you very much, and back to you, Chair.
All right, thank you so much for your presentation. And we are reminding participants that there is a session for question and answer, and it will be in some minutes ahead. We continue with the other presentations. Remember, we still have the Executive Director of VVA. We also have the Executive Director of RODI. For now, let's welcome the Executive Director of Vital Voices for Africa, Mr. Caleb Ayong. He will be talking about journalists having a better understanding of SDG 3 and how it can inspire media articles as well as audio, visual, as well as online productions on tobacco control. You're welcome, Mr. Caleb Ayong.
Thank you very much, Frida. And it's a pleasure having us all here today. Once again, dear colleagues, it is quite an honor to share with you and also learn from you, I must say, as I do this presentation on tobacco use and how it greatly affects, how it greatly acts as a barrier to the attainment of the Sustainable Development Goals. And like you know, we're going to focus more on SDG 3, but we would also look at how almost all the other sustainable goals are affected by tobacco use. Now, the primary objective of this presentation is to ensure that you have a better understanding of the SDGs, SDG 3, and how it can inspire media articles and productions on tobacco control. And to do that, we shall very briefly touch on how badly tobacco impacts the world, especially the youth. And then we will look at how the tobacco industry and tobacco products, how they are all a stumbling block for the attainment of several SDGs before coming specifically to the SDG 3. And we will look at why and how this matters to you, journalists, and what you can do to remedy the situation. Now, we already know that there is a big problem, and that is tobacco. We know that tobacco is the leading cause of preventable death in the world. And we know that at least 8 million people die from tobacco-related causes every year. But did you also know that 9 out of 10 smokers in the world get initiated into smoking before they're 18? We are talking about young people here. This is an important statistic for you. Well, that is because the industry knows that young people are vulnerable, yet they are most suitable for addiction at that age. And we cannot understand that our brains develop intensely while in the adolescent age. That is why at that age, most of us at our prime, even in school, education-wise. That is also when nicotine, that additive substance in tobacco products, is most effective. The tobacco industry is very aware of this, and that is why it targets children with aggressive marketing, like you would see in this picture. Now, take a look at the picture very well. You think that the position of that cigarette poster is just a coincidence? You think? Well, there is evidence to show that the tobacco industry specifically places such adverts where children will see them very often. Now, can you imagine how many school children come to this point of sale every day to buy things like pens, pencils, candies, snacks, or anything else that they will need for school? Because apparently this point of sale is placed next to a school. Now, I can assure you that it is not a coincidence that the advert is placed at that specific place. The tobacco industry specifically wanted it to be there because it wants to target the school children. Now, let us look at how tobacco and the tobacco industry is an obstacle to the SDGs in general. And what if I told you that 14 of the 17 sustainable development goals will not be attained if the tobacco industry continues to function normally as it does today? Well, I'd like us to observe this slide a little bit. Of course, we will start with SDG 1, which will not be attained because tobacco is a root cause of poverty. And I'm sure we all know that this is a fact. Of course, when there's with tobacco use, you have to spend a lot of money first to buy the products, and then you get sick and you go for healthcare and all of that. So tobacco will lead you to poverty. And who says poverty says hunger. So SDG 2 will not be achieved. Well, we'll say a lot about SDG 3 in the next slide, but we can look at SDG 4. Can we really afford education? Can we afford education when tobacco renders us poor and sick? Gender equality cannot be achieved as well because today women are beginning to take up smoking much higher, at much higher rates than even men. Sometimes, in some cases, they are almost getting as high as men. In some cases, they even surpass men in tobacco use, and they are bearing the consequences gravely. Water and sanitation is heavily impacted as cigarette butts are known to render them unpure, and you cannot talk of decent work and economic growth when there is documented evidence that the tobacco industry itself does not provide even the most basic safety requirements for workers in tobacco farms. We have participants here from Zambia who have tobacco farms in their areas, and they can testify to what I'm talking about here. Now you can imagine how unequal the world gets to be when the tobacco industry reaps billions from its products that render people poor and unhealthy. We cannot talk about equality here. You will also agree with me that, well, you will also agree with me that when people are poor and others are very rich, we cannot talk about sustainable cities and communities. Now for SDG 12, it is even responsible, or is it responsible? Is it even responsible to make tobacco products? Is it responsible to consume tobacco products? That's the question I'm asking you. So how can we talk about responsible consumption and production if the product itself is not responsible enough? And once again, we see cigarette butts worsening the conditions of our water bodies, rendering attainment of SDG 14 and the massive deforestation of ecological imbalance that occurs during the production of cigarettes, hindering attainment of SDG 15. And of course, tobacco industry interference renders objectives 16 and 17 very, very difficult to attain. Now, let's come to SDG 3. And with SDG 3, we know that we are looking at tobacco control as the public health guarantor. Achen talked a while ago about the WHO FCTC, and we are here talking about the SDGs now. SDG 3 calls for universal health coverage, disease prevention, mental health promotion, and we can see here that it is a guarantor of public health amongst the SDGs. But tobacco leads to the exact opposite of these goals, causing diseases like cancer, heart ailments, and respiratory disorders. I want to ask you a question. Think of any in the world, any non-communicable disease. I'll give you a few seconds. Think of any non-communicable disease you know and see if somehow it doesn't have a link with tobacco. I mean, any cancer, heart disease, lung disease, anything, any. Somewhere, somehow, tobacco is implicated. And I will not go into the long details of the health burden of the tobacco epidemic, but I want you to remember two facts here. Number one, remember that at least 8 million people die every year as a result of health-related, tobacco-related causes. That is a concern. The second statistic I want you to remember today is that there are at least 1.3 billion smokers in the world. It is a known fact that half of these smokers die as a result of their consumption of tobacco. So you can imagine this is a significant health burden. It is a significant obstruction to attainment of the Sustainable Development Goal, and especially SDG 3. Now, we have seen that tobacco use is an issue. We have seen that tobacco, all the other speakers around the world have, all the other speakers we have had have clearly shown us how tobacco use and the tobacco industry and its operations render life and render things difficult for us and makes life very miserable. What can we as journalists do? That is the next question we're asking, the next big question we have to answer. And of course, the first thing we would certainly do is to identify what problems we have and that we must tackle. These problems are well known. The tobacco industry aggressively markets to young people to specifically lure them into smoking. And there is a promotion of tobacco products through influencers and the use of sponsorship and parties that attract young people. There is, of course, the ever-present claim of newer tobacco products that the tobacco industry says are less harmful. Well, whatever that means. Now, what can we as journalists do in the media? First, we must continue to investigate and expose tobacco industry malpractices. And before we end this presentation, I would share some ideas on what we can do. I will share some questions that we can ask ourselves as journalists on how we can that can prick our minds to be more conscious of tobacco, of issues related to tobacco use and the tobacco industry. What else can we do? We can adequately inform and sensitize the public. That is our role as journalists, not only on tobacco industry manipulations, but how it affects the world, how it goes against the laws of our country, and how it is general bad behavior. Because trust me, that is all what the tobacco industry does. What else can we do? We can become an ambassador for positive change. What does this mean? In whatever you do, let tobacco control come to your mind. When you're moving around anywhere and you see a tobacco, a cigarette advert somewhere, it should come to your mind, hey, this is a cigarette advert. Is it legal? Is it supposed to be there? I mean, we can become very tobacco active because the tobacco industry is only there to make as much profits as it can to the detriment of our public health. We don't want that to happen. Next, of course, there will be possible obstacles when we try to report on tobacco industry and its tactics and strategies. The tobacco industry will try to, first of all, buy us as journalists so that we get to their side, and they'll want us to try to see things from their side. They'll say, no, this is not, they'll try that and say, no, if you look at it from this way, we are also doing good, we're also doing this here. Well, I can tell you that whatever the tobacco industry tries to do that may seem to be good in the eyes of the community, the tobacco industry is doing that to get a good name for itself, and it really doesn't care about the well-being of people. If it did, it will not make a product that kills as many people as we're talking about today. If the tobacco industry does not succeed to buy you, it will try to discredit you. They will try to discredit you maybe by saying or putting out a statement saying, oh, no, this is wrong. This journalist has said this and it's not correct. Or maybe, just anything that would make you try to derail you from your path and eventually lose guard. Of course, as journalists, we have to be strong and not let that distract us. And when they fail in this attempt, they will then try what they have done in several cases. They'll try to intimidate you. And who talks of a journalist and doesn't talk of intimidation? I'd like to know which credible journalist we have in this platform who has not felt like he has been like people have tried to bully him or her or intimidate him or her for carrying out a constructive and very well prepared investigative story that goes against the person or his or her interest. The industry will try to do that. But there are certain things that once we have them intact, and I think Paxina and other speakers said it, when you are factual, when you are truthful, when you are respectful, it is impossible for the tobacco industry to make good of its attempt to intimidate you. So these are a few things that we have to put in place. And if we do this, we can be sure that we can effectively and adequately expose, shame, isolate tobacco industry interference without fear of being reprimanded. Now, my last slide would try to prick our minds. I said this a while ago. Let us prick our minds a little and see. I told you one of the objectives of this presentation is to try to inspire tobacco control articles, as we are all journalists in this forum. Now, some questions I would like us to try to look into moving forward from this training, and after hearing all the dangers of tobacco and the bad things the tobacco industry does and how it targets our young people and all of that. Some key questions. When you answer these questions keenly and genuinely with your journalistic head, with your journalistic cap, you can come up with very wonderful stories. Question number one: how does the tobacco industry strategically target youth with aggressive marketing in my country? First thing you need to identify, does it happen in my country? And if it happens, is their aim really to replace the lives of those lost to their deadly products, like we have said here? What I'm trying to do here is the tobacco industry, when they're advertising, of course, they'll be advertising to say, oh, this product is very good, this product is light, this product is mild, and you can consume it, it would cause you less harm. Or they'll advertise, they'll sponsor, they'll do some form of corporate social responsibility. They'll go to a school and maybe provide water, build a school even, and say, oh yes, you're also doing good. That's another form of advertising. And they'll say, yes, we are doing good. You know, we are doing good to the economy. When you go deep and investigate as a journalist, do you think that indeed tobacco companies that make products that kill our children, that target our children specifically, would go again and build schools for those children because it cares for those children? I don't think so. If you search, you would see that the main reason it is doing that is to keep its image. Remember that tobacco has a bad name because their products kill, their products do everything. Of course, that is a well-known fact. So they try to keep their image clean. When you search very well, you will see that there's a hidden agenda. That could be a good investigation story for you. Second question: how does the tobacco industry and its activities really hinder the attainment of 14 of the 17 SDGs? And which of these apply to my country, and what can be done to remedy the situation? Do cigarette butts actually litter the water bodies of my country? Go and find out. Take an investigation, go to the beaches. Is it really true that some of these things we're talking about, because it's easy to say them here, but if you go to find out deeply, you can come up with amazing stories that can expose exactly how impactful tobacco industry activities can be to the SDGs. And sometimes you will be amazed at how deliberate some of these activities are. Third question: what are some of the palpable evidence of diseases caused by tobacco use in my country? How can I use one or two examples to provide evidence of the real dangers of tobacco use? What would be my call to action? What I'm trying to do here is to try to prick our minds. In our communities, there are people who have real evidence of the dangers of tobacco. You know, some people always say, no, when I smoke, my grandparents lived their lives, they smoked, and they lived for over 90 years, 100 years. So I can also consume tobacco. That's when I die, and all of that. Now, when you go around, if you can identify somebody who has been an actual victim, and you either see you see him breathing through a pipe, or maybe cannot speak, has to talk through a machine and all of that because of tobacco use. Those are clear examples where you can do actual, very insightful investigative stories. Remember, our aim here is to push our authorities to take action and protect our young people and the entire population from tobacco use. Question number 4. Are there cases of advertising of tobacco products or tobacco-related activities in my country? Does this go against any law of the country? How can I expose such practice in the most impactful way possible? If you answer these questions with your journalistic mind, trust me, you can come up with questions that would effectively and appropriately show just how bad the tobacco industry does, how much it goes against the laws of our countries, and with a specific objective to kill people, specifically to target people, young people especially, get them initiated into tobacco use and kill them. Those are great stories we can have. Another question, is the tobacco industry advertising better, in quotes, types of tobacco products in my country? Are these really better alternatives when they still cause harm, when they facilitate addiction, and when they have potential long-term consequences? This is one big argument. In fact, this is the tobacco industry's next move. They are coming on big on new products. They bring out new products and they claim that they are less harmful. They claim that they are more stylish, you know, and they make them really fancy. We've seen pictures of some of these products. The real objective is to attract young people, and then they say that they cause less harm. But hey, they still cause, even if we go by the fact that they cause less harm, they still cause harm. They are still harmful products. So we cannot talk about the tobacco industry. That is one strategy we really need to be wary of, you know. And when they say that, even when they say they are less harmful products, there is research, there is evidence that the research that the tobacco industry used to claim that these products are less harmful is very flawed. You can go ahead and investigate this and come up with big stories that can make waves in your country. Next question, I think this could be the last. Moving forward, anytime I hear or see anything related to tobacco or the tobacco industry, I should be asking myself, is it legal? Is it factual? Is it ethical? If not, how do I expose and denounce it in the most impactful way possible? Ask these questions to yourself the next time you're moving around anywhere in the street. And when you answer them genuinely, you'll be amazed at how impactful you can be. And you'll be amazed at how many investigative stories you can come up with that will create real impact in our lives. Well, I would leave us with this quote, which is coming from me. Our collective efforts can protect our youth, can promote health, and can advance the SDGs. Let us amplify the message, expose tobacco industry tactics, and inspire change through responsible journalism. Thank you very much, and I invite you to follow our social media platforms so that we can always interact and we'll be together even after this session. Thank you very much for your kind attention.
Thank you so much, Executive Director of Vital Voices for Africa, Mr. Caleb Ayong, for the presentation. And I want to believe journalists and other participants have taken down notes, especially with the investigative angles you've given that we can use to start, you know, an article, maybe an audio or a visual production on and about issues relating to tobacco. So we have the next presentation, and the time is some minutes to 3 p.m. And we understand that we need to end at 3 o'clock, actually. 3 o'clock Cameroon time now. So our next presentation will be done by the Executive Director of RODI. RODI stands for Renevlyn Development Initiative, and the Executive Director is Mr. Philip Japo. He's talking about insights journalists can gain into essential elements that can make a story of youth tobacco smoking appealing to the readers, to the listeners, as well as persons who watch TV stations. You're welcome, Mr. Philip Jakpo, Executive Director of RODI. Philip Jakpo, are you there?
So it's raining heavily here. It's raining bulls and cats, and I don't think we have too much time. But then let me share my slide. I'll try as much as possible to make sure I don't take too much time, so that we can finish up before 3 o'clock as we have promised. Can you see my slides?
Yes,
Can you
yes,
see
we
my slide?
can. Yes,
Yeah.
we can.
Okay, so as quickly as possible, this presentation is about producing captivating reports on tobacco, on youth tobacco addiction. Now, I'm not going to repeat what my colleagues have already said, but the thrust of this presentation is the role of the media in ensuring that we have credible reports. First of all, what's the role of the media in tobacco control? The WHO Empower package focuses on 6 effective measures that are to be adopted in reducing demand for tobacco products. The W there denotes 1 about the dangers of tobacco. And this package essentially talks about how the media can shape tobacco control related knowledge, opinions, and influences on policymakers. The mass media, television, radio, and newspapers, the online mediums, are essential elements and key components of tobacco control programs in different countries. So it is not just the WHO that understands the power of the media. Even the tobacco industry understands the power of the media. And statistics in 2019, we've not had a more recent one, talks about the largest cigarette and smokeless tobacco companies in US expending as much as $8.2 billion on advertising and promotional expenses in the US alone. Now you can imagine if we look at what is expended in different regions of the world, including in Africa. The tobacco industry is now operating in the largely under-regulated and borderless virtual space. And this space is the space where the industry is able to get children who mostly are on their tabs these days, on the internet, on Facebook. That platform is massively exploited by the tobacco industry. But for journalists, and that's why I said I don't want to repeat what every other person has mentioned, for a journalist who wants to write a good tobacco control story, there are places where you can get stories. There are front lines of reporting. The tobacco farms, example, tobacco factories, example, the social media platforms, examples, hospitals, schools, entertainment centers, homes of victims, shopping malls. These are the front lines for getting the kind of stories that will make very, very interesting reads. At the tobacco farms, for instance, you can see children on tobacco farms, that kind of things in Nigeria. In reporting tobacco control, you must leave the comfort of your office. Tobacco control cannot be done on armchair basis. Now, you must also interview the right people. And who are the kinds of people that we must interview to be able to get the kind of stories that my colleagues have mentioned? Tobacco farmers, students, children, medical professionals, government officials, victims of tobacco use, very, very important, tobacco control groups like ourselves, and of course, teachers who interact with children and know the recent trends in terms of children induction into smoking. Now, there's also the importance of using the right imagery. Child slavery in tobacco farms, secret smoking parties are just some examples of the kind of images. So you can see this kind of picture. I think this picture comes from way back 2009 or 2010, if I'm not mistaken. I actually took this picture in a tobacco farm in southwest Nigeria. So you can see these children. This young man is just 3 years old, and these are his brothers. Now, I remember something that came away from this interview and this interaction with these kids on tobacco nurseries. They told us something when we interviewed them. They said they were told to tend the tobacco leaves like babies. So you can see them, the way they interact with the tobacco leaves. Now, this is a good picture to tell a story. But this is not the only kind of picture. We have this kind of pictures. Now, here you have youths are being used to promote Palm Mall, one of the products of British American tobacco. Now, on my right, you see children who supposedly won scholarship. Conrad Foundation, which is funded by Foundation for Smoke-Free World, which of course gets money from Philip Morris. You need to use this kind of pictures to tell stories. Now, there are other places where you can also get information. The annual reports of these tobacco companies, their allies reports, they are allies of the industry, those who support them. News sources online, newsletters, annual general meetings and whatever they discuss there. You can get stories or things that the tobacco industry has to hide. Of course, on their social media accounts, British American Tobacco, for instance, is very, very active on Facebook. These are platforms that you can get what they are doing on X, on Instagram. Now, I want to end with this image. Now, what you have circled here is the exact depiction of what is happening. You have a man running, another with something, maybe a knife, to stab him. That is what is actually happening. But the media can make it something else. And here you can see this image, which inverts what is actually happening, and it will seem the man running away is actually trying to stab somebody. Now, this shows you the power of the media to shape narratives, to shape images, and to get policymakers to take decisions, to get the public to change a particular perception. So that is the power of the media. We must use our power of the pen to creatively address this menace, which tobacco is. So the next slide is actually the most important in this discussion. And the next slide there is all about thanking you for taking your time to be part of this engagement. Thank you very much. Is Frida there?
I'm here. Sorry. Thank you so much, Philip, for your presentation. And we have some minutes to go. At this time, we are opening the floor now for questions and answers. And we already have some questions in the chat box already, which we will be addressing. And persons who have questions to ask, you can as well drop them in the chat box. Or if you want to ask the questions maybe directly, you can ask it generally too, or except you have a particular speaker that you want for the person to answer your question directly. So this far, we have some questions. It is addressed to every participant. I think it's not for a particular person. And the question is in French. It's from Alain Tosono. He says, what can we do against the tobacco industries with their means and resources? How can they be fought such that the aspect of tobacco consumption is reduced and limited in communities. So Alain is asking, as journalists, what can we do against the tobacco industries with their means and resources? How can we fight them? I think the question is an open question for all our speakers, from the executive director of RDI to the executive director of VVA, as well as Mohammed, Acheng, and all other presenters. So now we are having questions and answers. Can we address the question from Alain? Anybody?
Okay, maybe I'll just say something and then I'll allow others. I think one of the tools for fighting the tobacco industry is actually the tool it also uses to promote itself and its products, which is the media. But not just media for media's sake, but a well-capacitated media. The industry peddles lies, and we need journalists who can put out the right facts out there. And that's why we are doing what we are doing. So once we have journalists who are capacitated, understand how the industry works, how they addict young people, how they market their products, like we heard from Oluchi and Prexina. Once we know how they operate, then we can write very, very informed and incisive reports that expose these things. And those things we write, of course, will help our government to be able to put in place the right policies. To check our governments in their relationship with the tobacco industry, which is happening a lot, and also to make them do the right thing. Now we are commemorating the World No Tobacco Day 2024. The theme for this year is protecting our children from tobacco industry interference. Now, all we have been discussing, all the insights we have heard from people like Acheng, Taleb, Mohammed, Prixina, Oluchi, have all been geared towards exposing how the industry works, the loopholes in the system that we need to address. And the greatest loophole today is that in as much as we have surveys that show that the youths are getting addicted to smoking and are getting addicted through different channels, we have seen that the surveys have not gone deep enough to address children as young as 10 and even 9 who these days have access to the internet and other platforms and are also getting addicted, like the 13, the 14, the 15-year-olds. So we anticipate that journalists who are participating in this, these are the kind of things that needs to be amplified so that the right policies and the right initiatives are going to be taken by government to address this menace. So I think that's my own intervention.
All right, thank you so much. Is there someone who wants to intervene on the question from Alain?
I don't want to, I assume we have many questions, so I wouldn't talk much, and I really, I hope that we can have 1 or 2 responses maximum so that we can get as many questions as possible with the limited time we have. What I'll quickly say is that another important thing, because we are all journalists here, and if we want to know what to do, I think we need to get informed. That's very important. As a journalist, be informed. And that's why in my presentation, I said you have to be a tobacco control, excuse me, you have to be a tobacco control ambassador. There are so many things that happen today, and sometimes we don't talk about it because we do not know that it is against the law. So you need to master your country's laws. Look at what the law says about tobacco products. Look at what you have already, your legal frameworks, and look at the WHO FCTC, which we have talked about today. Those are documents you can refer to. And you would find out that the tobacco industry does a lot of things that are against even their country's laws. There are so many things that need to be done by countries, and countries are reluctant to do these things. But you as journalists, if you have the right information and you do the right investigation, you can push your authorities, you can push other influential people, those who can really create that change. With the right information, with the right evidence, with the right strategies, you can push them to make the necessary change. Thank you very much.
Thank you so much, Mr. Alep Kayon. We have a question from Sarah Mawerere, and the question is directed to Acheng. She says, and the question is directed to Acheng. She says, tobacco and youth is a very big issue that requires persistent sensitization. However, there is a lack of resources to do it through the media. How do you advise on this? She said the question is to the previous speaker, and the previous speaker at the time was Acheng Otieno. We have a question from Sarah.
Yeah, thank you. Thank you very much, Sarah, for that question. And indeed, we understand the biggest burden that is being borne by particularly this tobacco and other related products. The biggest burden is being borne by the young people because they are the main targets by the industry. And it's very important to arm them with the right information. It's good to arm them with the knowledge on how to counter the tobacco industry. The issue is about resources. Yeah, I know tobacco control is resource intensive. Yet it's still the same tobacco control that is deficient of resources. When you look at even globally, the people who fund tobacco control are it's actually, I think, one or two funders globally, which I think it's Bloomberg and Bill and Melinda Gates. Those are the people who supported tobacco control, be it in Africa, be it in different parts of the world. But having said that, I do believe that there are certain things that do not really require massive resources for you to empower young people. Like, for instance, the things that we've been engaging with in Kenya and in different parts of the continent, actually. We've been engaging young people in high schools and in universities. Just the ambassadors and the people that we've always invited into our tobacco control efforts and who eventually become champions have also become the mouthpieces of informing other young people. So the idea of building ambassadors becomes a very sustainable approach to build people who are going to preach the messages of tobacco control beyond even the resources, despite the challenges that we are facing in terms of resources. Secondly, Philip, Caleb, and myself are actually big resources that actually can be used to support mostly information sharing in case we need information to be shared, in case we need any relevant or reliable data that might actually cost a lot of money to get. We've been in this field for a long time, and we can avail most of this data that is required, things that are required, particularly to support the initiative of empowering our young people. So maybe I understand that sometimes people look at resources in terms of money, but we may also want to look at resources in terms of the capacity that we have. In terms of the digital capacity that we can actually actively use, we are very good at this. In terms of sharing information that particularly within the communication sphere and within the journalists, in terms of what needs to be shared, we are very well equipped to share some of this information. I'd want to leave it at that. Maybe someone else may want to chime in, but for me, I feel that there is a lot that we can actually offer to empower our young people and also to make sure that our young people don't fall victims of the tobacco industry. Thank you.
Thank you so much. The questions are really coming in their numbers, even though we have to give a closing remark. But before we go, we take some few more questions. This one from Olivier Ajar is asking, are there any risks and dangers for media professionals in investigating or exposing the tobacco industry in our media?
Sorry, can I
Okay.
come in as quickly? I think we don't have more than 2 minutes more. So I think for the resource persons, I think we can put our contacts and then on the chat box, and then the last person that has this question can direct it to any one of us, so that we can do a quick screenshot before the network goes off, because we just have about 2 minutes.
Okay, okay.
Yes.
So we
So
all
I'm
can
putting
hear
mine
you.
right away.
Can we, those
All
who
right.
can you please turn on your cameras so that we can do screenshots, please? Philip, you take the screenshots? Will you take
We
the
still have more,
screenshots?
yeah, I can take it, but more people, we still need more people to
Turn on the cameras.
to put on their, a lot of people have not put on their screens. So let's do that as quickly as possible.
I have done.
Okay, so, oh, good. I think we can now. So at the count of 1, 2, 3, 4, 5. Yeah. So I think we can take another 1, 2, 3, 4, 4.5, and 5. So yeah, great. So we have some good shots already. Thank you very much. I think we can just quickly have the closing words. We want to thank all of you for joining us. It has been awesome. We had nearly 60 people participate in this. Even though the notice was very, very short, but this has shown that you guys are truly tobacco control champions. And I also want to thank our partners that we co-organized this and the resource persons. I want to thank Acheng. I want to thank Oluchi. I want to thank Mohammed. I want to thank Paxina. I want to thank my brother Caleb. And I want to thank all of you wonderful journalists. We are all journalists. So we know that anytime we call on you, we are going to hack into our voice. I want to add also that the presentations and the summaries will be sent to you to make it easy for your reports. My brother Caleb, maybe you want to throw something in, and then I change, and then we can then wrap it up so that this does not cut us off. Thank you.
Yes, thank you very much. So it's been a wonderful time we've spent together, and I hope that many of you have at least learned something new today. Many people have been asking for the presentations, and like we said, we have all your email addresses. Don't worry. Before getting access to this platform, you did fill a form to affirm that you have no links with the tobacco industry. And in that form, you provided your email addresses. So we have your email addresses. We would share them with everyone. And I would just like to say that please be on the lookout, because we would also have an evaluation of this session. When next we are going to organize events like this, we want to do even better. And so we'd like to see what some of you think, and how we can improve them subsequently. So please be on the lookout. We're going to send emails and we'll follow up with you. Thank you very much. It's been lovely spending time with you. And I would say happy World No Tobacco Day to you all. For those of you who can, World No Tobacco Day is tomorrow. We'll do our best to send you the videos and everything this evening. And we are anticipating that you can use this evening to do your media articles, your productions. And we would like articles to come up from tomorrow, if that is possible. Some of you might have internal constraints. Some of you might have deadlines to finish and publish today. That's understandable. But if your articles can start coming in from tomorrow morning, we think that as we get to World No Tobacco Day, we can have as many articles as possible. As we enter the World No Tobacco Day, we have as many articles as possible. Thank you very much again. It's been a real pleasure, and we hope that we can be together next time. Acheng, quickly before we leave. Acheng, any last word? You're muted in case you're talking, Acheng.
Oh, Caleb, sorry about that. I was responding to a call. Personally, I'm very thankful and I'm very happy for this particular show and event. I'm even happier that we had a very good team of journalists who joined us. And we believe that this is the only way that we can liberate ourselves from the shackles that the tobacco industry is trying to place our continent on. So thank you everyone very much. And just be on the lookout. We'll be sharing more information, and we hope to read more articles that will be published. Thank you, Caleb. That's all for me now. Thank you.
So that's it. And what can we say? It's been lovely having you together. We hope that the next time we call on you, we can see you. And that said, once again, happy World No Tobacco Day to everyone. We close this session with our screen once again. Happy World No Tobacco Day. Bye.
Bye-bye to everyone.
Bye.